had it even the recorded session.
Good evening, Father. Good evening, everyone.
Good evening.
Good evening, dear. Good evening. How are you all?
Are good. How about you?
I'm
Yeah,
fine.
I got great. All good. Dr. Silafa, you are hearing good about you so far.
I sent you a message.
Nice to see you, Anita.
Thank you. Thank you so much. Yeah, Annette, did you say some? Sorry, Mercy?
Yes, I said I sent you a message. You've not replied.
Yeah. You send me message now?
Yes.
Anything important?
Like 30
I-
minutes ago.
Yeah, I saw.
Okay.
Okay. Yeah, we'll do that.
Is it okay?
Good evening, Father.
Good evening. Yeah.
Good evening.
How are
Good
you,
evening,
Father?
everyone. Good evening. Good
Good
evening.
evening, Father.
And nobody responded to Dr. Salafa's question, right?
Yeah, only I think Mercy said she didn't attend yesterday, right? Yeah.
Let's discuss a couple of minutes
I attended yesterday.
until all reach. You can discuss, no problem. And also, I had
I
sent
attended yesterday.
some the 4 questions, right? You can discuss on those 4 questions probably.
Yeah,
Yeah, you remember those 4 questions?
Father, sorry, I interrupt one thing. Mercy, she sent the shorts, no, Father? Mercy's short
Yeah.
video.
Yeah.
I will send a photo for her, okay?
Yeah, okay.
Thank you, sorry.
Right. Maybe you can discuss. I'll share. Let me try if I can share that screenshot. One sec.
Yeah, for those who attended yesterday.
Yeah.
Let's
At
discuss.
least if there are some newcomers, you can benefit from it until the others reach. Couple of minutes. Let me check if I can.
Father,
that.
today no excuses, right? For the not opening the video, right? Yesterday there was excuse for care of Silafa, Dr. Silafa.
Today they are the same group of yesterday.
Yeah, today also we'll have excuses.
Yeah.
Excuses?
Sorry.
Okay.
It's
Yeah,
difficult.
no problem. No, because I saw someone in mobile's name, that's why I asked. Okay, Father. Thank you.
It's okay, no problem. I'll share those questions. Let's try discussing on that. Each one can share your experience. What did you learn? That will help me to go better. You can see, right?
Yes, you can see.
Reflection journal.
This is a reflection journal here.
Yeah, Dr. Salafa will lead. Others can just contribute. Each question can be read and discussed.
Yeah, just to remind ourselves, yesterday the case note was about referring one patient. His name was Barry Jones. He was recovering from back injury sustained at work while he was trying to lift the heavy box off the ground. So our task was to write a letter for the occupational therapist, Ms. Jane Graham. Father said there are 4 questions we should be reminded when we are writing the purpose. If we answer these questions, we will guarantee the 3 marks for writing a full and clear purpose. So who can remind us with these questions?
First question, we say who is the patient?
Yes.
And the second question, we can ask what is the problem of the patient? And I think the third question, why is referring the patient for the specialist or the and And what the last question I think is what is the assistant will be required, and I mean the goal of the
Yeah.
parent.
In other words, who needs assistant? Yes.
Yes, I can
In what?
remember. If father said, hello.
Yes, Mercy.
Okay, so I said I can remember father said for the introduction we have 4 components. First of all is the initiation, which is the greeting, followed by the purpose, and then the patient. After the patient, we now talk about, it also has the diagnosis and then the goal.
Exactly.
So maybe
When I came, it was off, like disconnected, without power. Somebody has kept the phone on. Your instrument is on. Yesterday's session, somebody is listening to. Yeah, you muted. Maybe you mute your audio so that others won't be disturbed. Yeah, please continue. Someone was listening to yesterday's when Dr. Salaf asked questions. Some student was so frightened, wanted to listen to yesterday's recording. Yes.
I was looking at the father's face and not speaking. Then I was thinking from where we are listening.
Okay, cool. No problem. Continue. No problem. If there are
Yes,
beginners
Mercy,
there.
do you want to continue?
Ma?
Yeah.
Okay, so for my question is that in some of the case notes, I don't think some of the case notes that I've come across, one of the case notes, there's no goal, but there's a purpose like assessment. It was a case of like referring the patient, transferring the patient to rehabilitation.
Okay.
Rehabilitation center for management. I was trying
Okay.
to.
Before we answer your question, let us go back to the 4 questions, and then we can answer your question.
Okay.
Yes, we should write, as you said, the purpose should be immediately apparent. So you should write, why are you writing? What help is needed? So this is the purpose. For example, I am writing to request. And then who need assistant? So this is the patient name. And in which context does he need assistant? With this context, we mean the diagnosis. For example, in the case of yesterday, I am writing to request a workplace assessment. So this is my purpose. For Mr. James or Barry Jones, for Mr. Jones. So this is who need assistance. And
Yes.
what is the context? Who is recovering from a severe lower back strain? So this is the context. And what is the goal? Why are we writing the letter for the occupational therapist? Because Mr. Barry Jones wishes to return back to his work. So these are the 4 questions. If we follow these questions and we answer them systematically, we will make sure that we have the full marks for the purpose. So again, who need assistance? In which context does he need assistance? And what is the goal? And what is the purpose of writing our letter? This one should be written in a systematic way. And Father said for the purpose paragraph, it is best to be a simple, complex sentence, but it can be, for example, 2 sentences or maximum 3 sentences. Regarding your question, if we didn't see the purpose, usually we know the purpose from the writing task, right? If we cannot find the purpose in the writing task, we should immediately go to the plan. And the plan usually will be found in the last visit. Yeah, sometimes the letters do not contain or do not state clearly the purpose in the writing task. So I need to go to the last visit to see what was the discussion and what was the plan of the patient from the last visit. I hope I answered your question.
Okay, thank you.
You're welcome. Anyone want to add? If you remember anything, you can add from yesterday's discussion. Do you remember the bicycle, the auto journey? Seems nobody is remembering or what?
So when I joined yesterday, I learned there was a power outage, so I couldn't participate at all. It was all silent.
Yes. So we can see the reflection journal here. There are 4 points, aspects of today's workshop. This is the questions. Did this one improve your confidence? And which writing assessment criteria do you still find most challenging and why? I think this is supposed to be answered in the YouTube comment space. So as Father usually said, our mistakes and our queries are his syllabus. So we should have answered this in the YouTube comment space. And usually I share this whenever I receive from Father, I share in my group, but I don't know whether they responded or not. So we can make it now if you want. You can comment on the YouTube space, comment space, answering these questions.
For that, if we have not watched yesterday's, we have to watch the recording. Then we have to comment our reflection.
For me personally, I think question number 2, which aspect or which OET writing assessment criterion do you still find most challenging and why? Myself, I think how to select the relevant case note, because sometimes we mix our medical knowledge with our task. And as we know, OET is basically a language test. For me, this is the most difficult aspect, actually.
Okay, though I didn't attend yesterday's class, but what I do find most challenging with the previous samples I've been writing is the conciseness in writing. At times, I would have written something and I'll go back to clean it, thinking it's not concise enough. So with that, I'll run out of time.
Yeah, conciseness and clarity. This is, I think, the same aspect. If you were able to select the relevant case notes, your letter will be concise and it will be clear purpose for the reader. I think you share me in the same aspect. And I believe for question number 4, specific action I have already taken, and I will continue doing that, watching further lectures. Actually, I started to watch this writing series. It was very good and well organized in the YouTube. This is one of the most useful and most important thing I have done. I'm continuously doing that. And the second thing, I can go through the sample letters, not to make them as template, but to help me in formalizing my sentences. I mean the sentence structure, selecting the relevant notes, the case notes, and so forth. I think if we go through these 2 steps, we'll improve much better. What do you think?
Hello. Hello, please. I need my own is request concerning the assignment that Father gave to us to select for 10, at least 10 case notes for us to bring out the relevant information. I need case notes that I will work on. Like that 10 case notes now I don't have. Apart from the one they sent on the group, this Mr. John's own. So I'm looking for case notes.
Case notes?
Yes.
Medicine or nursing?
Nursing.
Yeah. I can help you with this if you wish.
Okay, ma, thank you.
Yeah, I will write my phone number in the chat, so I can send for you WhatsApp or Telegram.
Okay, please put your
Yeah.
phone number on the chat.
Sure. And everyone who need help with this one, also I have a lot of case notes, medicine and nursing also.
Thank you, ma.
Mercy, also you can search in the file section of the main OET main platform, Telegram platform. EduSkills main platform, no? Are you there?
You said?
EduSkills Telegram main platform. Are you there?
Yes.
Yeah, you can search in the file section. You will find also material,
Okay.
case notes. Okay.
Is it done? Ready to go?
Yes, please, Father.
Yeah. Since yesterday we delayed a bit, people are waiting, I believe, still to come. 27, yeah. I request all of you just send some messages at YouTube so that we have just 3 chat rate, 3. We may reach 30 chat rate. All of you here may request at YouTube, Zoom classroom, just sign in, click on the live link as well. Hope the link is there in the main platform, right? Salafa, you have posted the link, right? Zoom link in your group?
Yes, repeatedly.
Okay. Should we wait for people?
Okay.
Hello?
Yes.
Yes. First of all, I would like to say thank you very much, Father Salim, for inviting us this useful session. My question is better to use paraphrasing in the text word or using the same word to avoid like any mistake in paraphrasing. I mean,
Yep.
like a patient came with symptom and sign of lung cancer.
Okay.
Should I say he came with clinical feature of cancer?
You are
like
asking,
this.
should you use the same words given in the case notes?
Yes.
No. As far as possible, don't use the same words. As far as possible, use the synonyms or synonymous expressions. If at all you don't find anything, use the same thing. But always try to use synonymous or synonyms.
Okay.
Always.
Thank you very much.
Better, the more you use other words, synonyms or synonymous expressions, your letter will be better scored.
Okay. Thank you very much.
Yes.
I believe also I have question in this regard, Father.
Please.
Sometimes, for example, during writing the same example, patient with lung cancer, for example, in the case note, they have written after the GP has examined the patient, he didn't find enlarged lymph nodes, he didn't find ascites, collection of fluid in the abdomen. There is no cough. This collectively, this constellation of symptoms is known as metastatic symptoms. Is it possible for me to write there are no signs of local or distant metastasis instead of writing everywhere?
Definitely. You are supposed to write that. Collective word. Use of collective words is one criteria where your language will be more powerful and rich. Instead of using many words, substitute. One word substitutes, we call it. That makes your language more professional and more rich.
Exactly. This is one of our debates during our discussion.
Yeah. Definitely. You have to use. Wherever possible, that's what you said, you are supposed to summarize.
Exactly. Effective summarization.
Summarize. Yeah. Each word in the instruction is very meaningful and has to be understood in detail.
Okay. Thank you, Father.
You're welcome. And the other doubt about the date, it was cleared, right? You had sent me some.
The date. Yeah, we have doubt regarding the best format of the date. I have took some screenshot from your lectures that you said there are some things that are right but not appreciated. Yes, the best one is to write in months, not in numbers.
Yeah, that's what I said. The other options I have given right and appreciated. Some things are right but not appreciated.
Exactly.
And the best evidence for you, go to the sample letters. You can exactly see all those letters use that format. Then why should you go for another risk? Because dates are used in different ways in different parts of the country. There are many methods of writing the rate. So let's appreciate or let's conform to OET method.
Okay.
Let's continue. If you have anything, 1 minute.
Group, try to remember our debates, even write in the chat. This is a good chance for us to clear our debates.
Yeah. If you have any concerns, you can ask me. Based on that, I can continue the session.
I think also, Father, we have problem in differentiating the ISPER method and the chronological from present to past. I have seen in the website, they said, do not follow template. And there are 3 methods of writing the letter. I know the most appreciated is the ISPER. But it is very similar to what is known as chronological from present to past. For example, if I have a patient with a long-standing condition and now he presented with deterioration, I supposed to start with what happened today, the situation today. This I can write in 2 ways. Either I can use ISPER or I can go chronological, but from present to past. I
Yes.
think there is some debate in this area.
Which one should be used? You mean debate is regarding
No,
which method to be
differentiating
used?
the methods. Yeah, we don't know exactly what is the difference between ISPER and chronological from present to past.
Now, chronological method is a method, but it is not confirmed or appreciated or approved by international communities.
Okay.
ISBAR is the method. That's the only difference. It's the method approved internationally, only method of writing letters by health professionals internationally. That's the only difference. You can use anything for your purpose of OET. Any method is okay, but when you have to go abroad, again you will have to learn these things. Yeah. So what I feel, if you do it now, that's the best thing.
Yes.
You have double purpose served. Yes. Others don't have any concerns? All those, please send some messages at, it's only 14, chat rate is 14. We need to read 30 to begin. Send some few messages at YouTube. Thank you for the super chats and memberships. Yeah. Those green color name with a star denotes memberships, okay? And the crown denotes super chat. Super chat you can get starting from 10 Indian rupees. That also helps the reach of the platform and supports the mission. Okay, let's have a minute silent prayer.
I'm finding it difficult to do the super chat. Not accepting my card. But they are deducting from my money. I don't know why.
So once again, good morning, good afternoon, good evening, wherever you are from. Have a nice day. Let's enjoy writing tips and writing strategies, OET writing focused on medicine for doctors. However, it's also useful for nurses. I don't find any major differences. There are only minor differences. But if at all you have to get more than 450, you can consider the differences. If you have 450 is enough, A plus is enough for you, there is no difference. Okay. When you have to get 500 out of 500, you have minor differences. Okay. So if you are welcome to EduSkills. So it made easy. If you're watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our mission and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially and emotionally struggling. And you know, the foundation principle of our mission is to help the poor people and also those who are emotionally struggling. Though they are rich, they have a lot of issues at home otherwise. So let's walk into, and chat rate is 16. I'm waiting one more minute. Just send some chats, everybody. Yeah, may I request all of you, if you have a second instrument, always it's better to use one more instrument so that you can attend better. Sign into YouTube live. And I am not able to access the Zoom classroom chat box when I am sharing. So please try to interact at YouTube comment space. Yeah. Is anyone else to be made co-host? Anitya is co-host, right? No. You entered again. Okay.
Thank you, Father, for your kindness. I have seen me and one of our group member is also a co-host. Thank you so much.
Okay, you're welcome. You're welcome. Because I don't know your members, right? Usually our admins are advised not to admit instrument names or
I sent message for them, try to
it's okay,
change
it's
their
okay.
names to the
Yeah, it's
devices.
okay. It's okay, no problem. This is exceptional mainly for your group, so you can admit no issues. But there wasn't much different disturbance yesterday. Your group members behaved very respectfully. There was no distractions as such. Only once we had a disturbance. That's all.
Hello.
Yes, please.
I'm finding it difficult to do super chat. I don't know why.
Difficult to?
To do super chat on YouTube.
Maybe you have not subscribed. Unless you have subscribed to the channel, you cannot send messages at YouTube.
I'm sending message on YouTube.
Yeah, but then you can't see the messages?
Yes, I can see message. I'm sending message on YouTube, but that super
Okay,
chat
thank
is
you.
not accepting my card.
No, it doesn't affect. It doesn't cost anything sending messages at YouTube. It is 26. Don't stop. Let's go 4 more. Chat rate 4 more.
But
That's
the super
minimum
chat,
there. Sorry?
I want to get it. Sorry, the super chat.
Super chat is
payment-
just, super chat is below there where you type the comment. There is a dollar icon.
Yes.
You can click on it. It's like starts from 10 rupees, Indian rupees, or whatever
Yes.
you want to purchase. It's a support to the mission. At the same time, it helps reach more people, deserving people. Yeah.
I understand, but it's not accepting my card.
Okay, cool. You can try later. No problem.
Is it because
And
of
again,
my country? I don't know.
Yeah, it's okay. That doesn't make any difference. Okay. And even ebooks, people are asking me, or it's not yet published. Maybe the second volume will be ready by July 10, maybe within a week or so. And as of now, we are accepting some contributions to complete this work. But then it's free. And if you are not working and financially, if you have problems, please let me know. I will send you. Okay. No problem. But it is not to be posted anywhere. As of now, we have not completed the copyright issues and other things for legal purposes. Yeah. Yes. And we will sort it out. Maybe even beginners will have one session separate. Today, I'll give you some guidelines on beginners as well. And there is nothing. Ultimately, if you go through those things, the steps, 21 steps I have reduced for other people into 15 steps. Okay. If you go through those steps, everything is there, recorded sessions are there. And we will also work out more of case notes. As of now, welcome doctors. All this is dedicated for all the doctors. At the same time, it's for all the professions. Okay, let me share my screen. And I didn't find any response for my, what is that? Analytics I asked, right? Why was that? Hello?
You mean the 4 questions?
Yeah, 4 questions. I didn't find any response in the YouTube. Is it I missed it or there was no response at all? Or you are shy to respond?
Responded verbally.
This is here some have responded, but here also many have not responded. This is psychological. Unless you go to those reflections, you will improve. I don't say you don't improve, but it will be too late. That's why we take it in that way. Okay. Let's see. And let's check. And writing is, I tell you, the simplest thing, provided you go step by step. Okay. Oh my, yes. But let me check how is my screen seen in the YouTube. Sorry, give me one sec. I'll just check the YouTube. Get some snacks or some juice, tea, coffee, so that you enjoy the journey. Yes. Yes. Yeah. Okay. So, Mr. Barry Jones, if you want to see how I have explained the briefing of it, just to we go before the 15 steps. If you are a beginner, try with these steps, okay? Don't hurry up. Don't try to write your Excel letters at all. First step, identify the relevant, semi-relevant, or irrelevant case notes, which we are doing yesterday. Identify the key issues. Highlight the keywords, synonyms, reference in the case note. Highlight the aspects, medical history, medication, vital signs, etc., related to the key issues. So there are two methods. Yesterday, for the beginners, I played a video where Jake Thompson, I believe. There was some case note. Actually, knee surgery and immobility. That one thing clearly explained. That's another method of finding it. Now we have gone by the chronological thing, and nowhere you'll find the method going from the latest to the oldest. That is the easiest way to save time. Second one, transform each case note into a simple sentence. Each case note, I'll show you one or a few examples today. Okay, then check with Grammarly Free, which we have explained in our videos clearly. These simple sentences you can check in the Grammarly, and Grammarly will guide you and explain all the details. Sorry. Then transform simple sentences into compound sentence. Then check with Grammarly Free again. Okay. Then 6, transform simple sentences and compound sentences into complex sentences. That doesn't mean you have to transform everything, but or is apt couple of sentences, 3, 4, or 5. Then again check with Grammarly. Good. Step 8, write a story or speak out of the patient. Story of the patient. Just speak out. All right. Okay. Then again, if you have written, check with Grammarly Free. Okay. Then 10th, segregate the case notes, sentences based on the key issues. Based on the key issues, which we will show you today. 11th, arrange the sentences, points according to sequence, cohesion and coherence, we call it. There should be a sequence, topic sentence, supporting sentence, developing sentence, then the link or conclusion. Then writing paragraphs, as Dr. Salafa mentioned, it can be chronological or thematic or issue-based. Either of these you can use. There are 2 ways of approaching, which I'll teach you. And introductory phrases, connective words, sequential words are very, very important. Introductory phrases, in the morning or on admission. And after all the introductory phrases, make sure there is a comma. Sorry.
Back at classroom.
Okay, please mute if you are not talking to me. Please mute. If you're not talking to me, please mute. When you talk to me, just touch the microphone and speak, okay? And that is very, very important. People lose marks there. Introductory phrases, comma. Okay? Then connective words, sequential words, firstly, secondly, thirdly, or later, subsequently, or those words. Then start writing the letter in the writing format, address, date, salutation, line, introductory paragraph, or purpose paragraph, body paragraphs, request, recommendation paragraph, sign off. Mistakes to be avoided in OET writing. I've explained all the possible mistakes. Then self-correction strategies. I have given strategies where you can correct your letters definitely to gain 400 marks. You don't require anybody to correct you because I have given every line, every word, what tends to be used regarding which case note, where, how, and all those corrections, possible corrections I have given. Self-correction strategies from an examiner's point of view. Okay, this we have seen yesterday, the body of the paragraph. We are just glancing to it. So you have body paragraph, history, body paragraph 2, treatment and progress, body paragraph 4, current status, then the closing request. Okay, purpose paragraph flow diagram. This is one major mistake. Okay, some people mix up history with treatment and current status, everything they mix up in one paragraph. You will never score. And you require only 60% marks in writing, 300, right? It's a very, very simple score. Okay, purpose. Why am I writing? Body, paragraph 1, history, occupation, injury, diagnosis as regards this case. Body paragraph 2, treatment, that is physiotherapy, recovery, is recovering well, progress, all those things. Body paragraph 3, current status, what is happening now, symptoms, limitations, return to work, recommendation. Okay. Then closing, request action, workplace assessment, suitable duties, offer further information. Okay. Now, top one tip is this: a common band C mistake is mixing history, treatment, and current status in the same paragraph. Grade A writers ensure each paragraph has a single focus. One topic, one idea, one paragraph. Okay. So one paragraph, one idea. Okay. Now here, sorry, I'll just connect the case note. Somebody was discussing selection of case note is challenging, right?
Yes, Father, this was me.
Okay, okay. Let me share the case note, okay? Just, okay, let me, yes. Yes. Case note is here, today's case note. This we have already taken. Now, why do you say that it's challenging? Can you just give me some more idea?
No, I said in general, this is regarding the question, the 4 questions you have posted. I said my
Okay.
challenge is usually in selecting the relevant cases. Yeah, not for this one specific.
And if you can go to any channel, anywhere, see, I'm taking practical things and giving you how to kill the greatest enemy, time. So anywhere you can find people start selecting the case notes from this. You can see the screen, right?
Yeah, you can see.
Word document.
Yes.
Yeah.
Seen.
See, people start from 28th June, then 29th June, 30th June. We are wasting our time. So what I said, we go from here.
Yes.
So if there are beginners, one more time I'm repeating. First, as you know, we go to writing task, right?
Yes.
Okay. Using the information in the case notes is very, very important statement. Don't use any of your knowledge. Maybe you have better knowledge than given in the case notes. Never add those things. You will be penalized, definitely. Then write a letter to Graham, an occupational therapist. That is also very, very important. Whom you are writing to. Not the name, but occupational therapist is important. Detailing Mr. John's situation. Then requesting an assessment of workplace. These things are very important. Okay, that tells you what is the purpose of this letter. And address the letter recipients. This is the address. Okay, what address is to be written? As I said, nothing to be done, just copy and paste, but remove, put them in different, remove commas and put in different lines. At each comma, just cut the line and put it in the next line. Okay, nothing else to be done. Don't change anything. You don't require even full stop at the end. Okay, no commas, no full stop. Be clear about it, because that's not a sentence to put a full stop after Newtown. Here it is written as a sentence. That's why they have comma and full stop. Now you will be writing in an address format. Okay. Yes.
Father, this first sentence, I think, is an example of the opening sentences you have talked about, right? Using the information in the case notes, comma.
Yeah. That is using the information in the case notes, comma. Yeah, write a letter to Graham, Miss Graham. That is not introductory phrase. This is like it's they are putting an information there. Okay. It's not actually. I'll give you the examples for as I go into the paragraphs. Yeah, this is like they are putting 2 concepts into one sentence. Okay. Yeah. Okay. Then in your answer, so this is clear. Purpose is clear. whom your writing is clear, then in your answer, expand the relevant notes into complete sentences. This is very important, and one of the major mistakes, even in all your letters, is run-on sentences and wordy sentences. Run-on and wordy sentences, which I'll explain to you. Then do not use not form. Somebody was asking, should I use different words? They are saying don't use not form. Use different words as much as possible. Use letter format. The format should be clearly letter format. In that, what I said, letter format could be anything, but these steps are there, whatever you use. But the approach could be ISBA. That's the only approach internationally accepted. And letter should be approximately 180 to 200 words. That also tells you it can be little more or little less, provided you don't.
I have a question.
If it is less than 180, 170 or so, or 160, you should make sure you have not left any relevant case notes and you have powerfully presented. And if it is more than 180, you should make sure you haven't included any relevant case note.
Father,
180 is, please.
180 in 200 words, it should be the body, not including the
only body. Only body.
Okay.
Address, those things are not assessed at all.
Okay.
1, 2, 3, I have numbered it. I will show you. 1, 2, 3 is not assessed. Only from the purpose paragraph to request. That's all being assessed. That is being counted.
Okay.
Okay. Yeah.
Thank you.
And so first you come here, then you go back. Where if you don't get a clarity here, you can come here in the last discussions, treatment, return to work. Okay. So this is also important. The next step, returning to work is the reason. Requesting assessment of workplace, already it is there. Advice on duties patient can perform. Okay. So after the writing task, have a glance at the latest information, maybe one heading, so that you get more clarity. So why the workplace assessment is required? The reason is important because he wants to return to work, and advice on what duties can be performed. The assessment of his workplace should include what duties patient can perform. Then where will you go? To the name. Date, assume today's date is 30th August. And this is the date of your letter, okay? That will be given, definitely given. Don't discuss on it at all. That will be definitely given. This is the date you have to write in your letter. You are a doctor. Who are you? You should know. Okay. You are a doctor. That measurement is a regular patient of yours. And there is a big discussion and all those things going on about known and unknown cases. But I doubt how far that affects your letter. After writing this letter, you tell me how much it affects, okay? Now, name is there. For rail line, you require name and?
Date of birth.
Date of birth. That is relevant. No doubt, right?
Yes.
Yes. Now, address of the patient?
Not relevant.
Not required. Not required. So as of now, we are deleting it, okay? Okay. We'll delete it later. We'll cut it now. We'll delete it later, okay? To give some clarity, yeah. The reason for presenting, this is important, very, very, very important. Reason for presenting. What is the reason? Wants to return to work. That is the reason.
The goal.
Yes. After back injury, employer support you. This is also important because you are asking for workplace assessment. So the support of employer is very, very critical. On that basis, you can write your assessment. Now, medical history, appendix removed in 1988. This you are writing this letter 2019. 2019. This appendix was removed in 1988. So we said that is not required. If you have any doubts, you can ask me. Okay, that's why we are just fast. We are going into it. Then, since you said it's challenging, we'll teach you with a little more clarity. Now, social background: married, 3 children. Susan Jones.
Not required.
Not required, because nothing to do with workplace assessment. Whether you have 3 children or 4 children or 5 children, nothing to do with workplace. They are not taking the children to the workplace. And work, and any word that associates with work or synonyms, anything, that's very, very important. Drives, forklift, in a large warehouse, requires, this is important, prolonged sitting and occasional heavy lifting. See, now this is connected with the work. That's why I said this is the most important aspect. Okay, current medication. Do you require when you write to your occupational therapist?
Not required.
Not required. Some people suggest maybe you can write the name of those medications, but it doesn't affect anyway the workplace assessment. I don't know. If at all you require, you can add it as if you want to fill the words, if you have shortage of words. Otherwise, I don't recommend, because you are writing to a occupational therapist. And condition history, I said, where are you going? When you have so many chronological dates given, different visits, what you have to do?
From the last date and
from the last. Start from last date. Why? Because you will have the latest information there. So then when you go back, you know that's being repeated here, or this is outdated. Okay. For beginners, in the beginning session, I'll tell you what are the exact things which are not relevant or which are semi-relevant. What are the criteria to decide on that? Okay. And now here, 30th June 2019, progress back, recovering well.
Still okay.
Yeah. For assessment, he requires that information, right?
Yes.
Moving stiffy.
Was required.
Yeah. Moving stiffy, but range of motion has improved.
Decreased.
Improved. Increased. Yeah. Arrow is on like upwards, right?
Yes.
Pain after 30 minutes of sitting or lying down. This is important because for workplace assessment, if he has to sit long, they said, no?
Yeah.
Right? So, physio still attending appointments. That is semi-relevant, you can say. Is it relevant?
Yeah.
Irrelevant, Father.
Yeah, semi-relevant, you can say. Physio still is attending. Yeah. Exercise walking 30 minutes per day. Tiring.
Yes.
Yeah, that's important. And discussion, patient board discouraged, wants to return to work.
Wants to return
to work. Already we have that's a repetition, but still that's very important. That's why we'll post it. We'll mark it again. Okay. Actually, we have already marked it, right?
Yes.
Yeah. So these emotional things are not required. Yes. Return to work if no lifting and with regular breaks. So this goes to advice.
Yes, information.
Yeah, advice. So that is very important. No lifting, regular back will form your advice in the workplace assessment. Letter to OT requesting assessment of workplace. Assessment of workplace already we have seen. It's very important. Advice on duties patient can perform. In that, under that, no lifting, regular backs will be recommended. Okay, now keep these concepts in mind. Recovering well, still there is pain, moving stiffy, but range of motion has increased, and sitting or lying down, there is pain, increased pain, all those things. Now coming to previous date, 29 June 2019. Recovering well. Do you require?
Repetition.
Not required, Father. Already mentioned.
Repetition. Yeah, it is repetition. All repetitions are irrelevant. Still moving very stiffy.
Same.
Moving
Repetition.
stiffy, it's a repetition. So you don't have any difficulty, no confusion to just select it out. Physio attending regular appointments. Repetition. Yeah, already we have here, right?
Yes.
Yeah, the last date. Exercise walking 15 to 30 minutes per day, very tiring. We have walking 30 minutes per day. So this is outdated. This is not exactly repetition, but outdated information. So not relevant. Treatment.
Not required.
Not required.
Relevant.
Yeah, not required. Extended time of work 30 days to review in 30 days.
All the information.
Of work 30 days. Semi-relevant you can say if you want to consider. That will be repetition later. Okay. To review after 30 days.
Not
That's
required.
already done. Review is already over.
Yes.
Right. Previous review it is speaking about. Now previous date 20 June 2019. Progress still so.
Repetition.
So
Still.
not only repetition, it's outdated as well, right?
Outdated. Outdated.
Moving very stiffy again, you see. Though it looks so big case note, how easily you can eliminate. Okay. Exercise very painful, but the patient is compliant. This is
Outdated.
important.
Yeah.
This is important. Very important.
Patient is
Indians don't
compliant.
understand the importance.
Complaint.
Compliant. Okay,
Compliant.
this is very important. Patient is compliant. This exercise is very painful. It's not required because when patient compliance, it's understood. If you want it, make it semi-relevant. Yeah,
Down.
please.
I said already mentioned in the recent visit.
Yeah.
Very painful.
Yes. Exercise walking up to 10 minutes, already repetition. You have 30 minutes, right?
Yes.
Yes. So you see, it looks very long case note, but you can strike out within no time. This is the business that you have to do in your reading time, 5 minutes. And those 5 minutes, you cannot mark anything on your booklet, okay? You have to just strictly read without touching the pen. Okay, after 5 minutes, you can start marking, but you can mark in your brain. Treatment, extended time of work, 30 days. To review, 30 offs. Again, repeated, right? Off work, 30 days. Repetition, right?
Yes.
It is here. Yes. Come on, interact. Now that is over. Coming back to 31 May 2019. Presentation. Normally, presentation in the first date is important. That tells you what is the main issue. Okay? First date. Yeah, this tells you what is the main complaint, chief complaint. Okay?
Yes, important.
4 days initial strain is not required because whether he came on the 4th day or 5th day, does it affect his workplace assessment? That's the first appointment. No rest, pain worsening. That is outdated. Do you understand? That is the first appointment long back. So it's outdated. And X-ray, no disc problems.
No need.
No.
Actually, yeah, if you want, you can keep it as a semi-relevant, but actually not required because no disc problems means it doesn't affect. If there is disc problem, that is relevant. Okay, diagnosis, lower back strain, severe. So it is already hurt lifting heavy box off floor. You can lower back, you can take it, okay?
Yes.
Because it tells you exactly where. Earlier it says, hurt back lifting heavy box off floor at work. Now it says lower back strain diagnosis. Treatment, exercise walking daily, gradually increasing time and distance. Do you require?
Yeah, I think
Come on.
No.
Because I will keep it as semi-relevant, maybe to increase my count.
Sorry?
What? I said this one, the initial advice, we can keep it as semi-relevant in case
because exercise walking program is already there. So you can mention it in general. If you want to, you can keep it a walking regime or a gradual at the semi-relevant, but actually you have that same information repeated later. Okay?
Yes.
Walking. So altogether you can connect gradual improvement through walking regime. Referral to physio already, what was there. If you want, you can keep it. So the first and last will be important, but in between whatever comes you have seen, most of the things are stuck. And prescription?
We said not required.
Not required.
Not needed.
And 30 days off and certificate to give employer, that's also outdated and already repeating. To review in 30 days, repetition. Did you get it?
Yeah.
Yes, ma'am.
This is clear, like whatever you highlighted is clear.
Yes.
So
Yes.
I am going to delete these things, what is not relevant. We are sure about those things. If you have done some doubt, we have kept it semi-relevant with a different color. Yes. How beautiful. How can you have challenge here? You're a health professionals. I can feel challenged because I'm not a doctor or health professional. Are you with me?
Yes.
Yes, Father.
Yes, Father.
Yeah, keep interacting, okay? Otherwise, I will lose my energy. Yes. See now? It's so clean.
Yeah.
Yeah. Now, can you just write down the important things, don't whatever is important on a page? Don't write the details. For example, Mr. Barry Jones, 11th June 1973, then wants to return to work, employer supportive, put in different lines. Don't write continuously on each line, okay, in a page. Okay. Who is very conversant, you can put in YouTube comment space also, so I can understand you have understood. In the page, I may not see. If you are very conversant with the typing or recording, audio recording, please, Father, could show us how to write the letter practical while you are explaining. Definitely. That's what we are going to do. This is a way to write the letter. You can't simply write the letter. First, you have to select the case notes, right? Yes. And yesterday in the purpose paragraph, I have clearly given you how to write with examples, with the syntax, word order, and different parts. We'll be diagnosing the entire body paragraphs as well in the same way, if you have patience. Hello.
Father, you said we should write the one in green, right?
Yeah, one in green. Yeah, one in green. In short phrases, that gives you correct idea. On one side of the page, you write. Okay. Should I show you?
Okay.
Maybe I will just copy and show you. Okay. This is the way you have to practice. That's why I'm trying to practice it now itself. So now, like, it will look like this. First, you have a date here. Hope you are doing it, right?
Yes.
I still have concerns on how to write the purpose paragraph. Please, Father, could you explain the purpose paragraph? Did you attend yesterday's session? At YouTube, I am asking. Somebody is asking me regarding explaining purpose paragraph. If you're a person who has not attended yesterday's, we will have another session for you. Let me know, okay? Just put in the comment space if you are not at Zoom classroom. These exercises will definitely help you. That's why I'm spending time on this, okay? Because you yourself will not do these things. Did you get it?
Yes.
Yes, Father.
Yes, Father.
Yeah. Maybe here for the initial stage, we can also remove those. What I mean, the semi-relevant can be removed, then you can use it later if you want. Okay. As of now, let me post it here. Yeah. You have yes. See, you have these things, right? This color it is. These are things you have. Okay. Now, next step is, this is the relevant case note, most relevant. When required, the semi-relevant can be used if you need more word count or something like that. Now let's go to this step, you must do it. Okay. Now occupation, forklift driver. You can see the PPT, right? No.
PPT, no. Only the
Sorry,
word.
I'll share it again. Yes. So you see, occupation forklift driver, problem, lower back strain, differentiate between problem and purpose. Many of your essay, this one purpose paragraph, keeps problem, not the purpose. But the paragraph is purpose paragraph. So problem itself is not enough. Problem becomes the context. But purpose is different. There's a real confusion. That's why I made it this way. Occupation forklift driver. That's the background of the issue. Problem is lower back strain. But the purpose of the letter is now lower back strain is not the purpose. Request workplace assessment by occupational therapist. So workplace assessment is the thing. Sorry. Okay. Now you see, these are the case notes what you have selected. There's a case note, one spelling is missing. Okay, since I'm sharing, I can't write it here. Do you have these case notes? Now we are getting into another psycho-scientific activity. Okay, this is going to be very useful when you have been in favor of this activity. Okay, now you know purpose, paranum history, treatment, current status, closing. Will you be able to put in those case notes into these boxes? You can just create 4 boxes, 5 boxes. Roughly, you can create on a page. Even beginners, this is going to be very useful for you. Hi, Shanmuga. Good evening.
Hello.
Yes.
Good evening, Father.
Shanmuga passed her OET successfully, cracked 3 years before. Still, she is attending sessions. She attends almost all the sessions. Yeah, she is in UK.
Hello, Father.
Yes,
can I ask
yeah.
a question?
Please.
Yeah, can I use the ISPAR method instead this one?
In this one, no. Now we are not touching that ISPAR method as such. I will refer to it, but then you should have these clarity. Then we can put into ISPAR. You know, ISPAR means you have to put into those 4 categories. We'll easily apply it. Who asked it?
Sheila.
Okay, cool. Okay, we'll be getting into it. Then it's only for you to insert ISBAR, that's all. But these are the preliminary steps.
Because the ISPAR method for me is easier than.
Okay, definitely. We will be dealing with it. As of now, this is like how to select the case notes and why we have selected those case notes and which case note belongs to which paragraph, which part of the letter.
Okay.
This clarity must be there before you do anything. What are the relevant case notes? Relevant or semi-relevant, and why they are relevant or semi-relevant. We already explained it. Now, you know already these are relevant case notes, right? You have written. Where should I put it? In the paragraph.
Yeah.
Okay?
Okay,
So if you can just write into those columns, you can use short forms, okay? You know, write full. Then we'll check whether your assessment is right. I'll show you field. I have done it. Personally, I have done it, spending time so that I can show you. I will be showing exactly which case note belongs where and why. What belongs to purpose? What belongs to para number 1, that is history, medical history. Then para number 2 speaks about the treatment and the progress. Okay? Treatment and progress. Para 3 speaks about current status. What's the situation of the patient now? Then the closing or the request. Yes. Complaint recovering well, still in pain. I am writing this letter to request on an assessment of workplace for Mr. Barry Jones. It is not of workplace for Mr. Barry Jones, who is recovering from back pain. Initiation Purpose patient. Okay, needs little polishing, that's all. Chandravadani, yes. And all your concerns you can post. Yeah, and I will be looking into it later. Your admins will look into it and we'll have an assessment and we'll customize the next sessions. Have you done with?
Yes. Yes, Father.
If you have doubt, keep it separate below. Some case notes. If you have done it, just say yes in the YouTube comments, please. Para one hurts back at work while lifting a heavy box off the floor. Okay. And okay, empowering each other. Purpose, request your workplace assessment test. Well done. Yes. Just type in yes in the comment space. You have done. Only 1, 2, 3, 4, 5, 6 yes or thumbs up. Anything is okay. Only 6 have reached. I'm waiting for other yes.
Father, is the word worsening formal, or can I use it in my writing? Or better to paraphrase it, for example, deteriorating, something like this.
Paraphrasing is always appreciated.
But I
OET
mean, if I use it,
paraphrasing is one of the sweetest things they appreciate.
yeah,
The better
I mean,
you know to paraphrase, the best
if
your
it is
letter
not
is.
written, for example, if it was not in the case note, and I want to describe a patient condition, can I use it as a formal word?
No, you can use any word, but what you should not insert any information. No new information should be inserted.
Yeah.
Do you get me?
Yes, yes.
But whatever the information given, you can paraphrase, you can use different words, synonyms, synonymous expressions.
Yeah, because this was one of our debates. If we want to describe the patient condition, some of us, they believe the word worsening is not formal. So we should not write it.
Okay,
Instead,
I will tell you the differences as we come to the paragraph, okay? I'll give you clear examples.
Okay.
This happens in the last session at the end when I give you self-assessment criteria or how you can enhance the letter score.
Okay.
Okay. Good. Now you see, purpose wants to return to work. Severe lower back strain, workplace assessment. These are the case notes going to purpose paragraph. And history, severe lower back strain. This is there in the purpose as well. But that is it comes in the history as well, first paragraph. And occupation. The reason for this severe lower back strain is due to his occupation, which requires prolonged sitting, heavy lifting, hurt lifting, heavy box. See how beautifully it connects. This is the problem, and this is the context, forklift driver, and reason for his prolonged sitting, heavy lifting. And typically he lifted something very heavy box and he got hurt in the lower back. And treatment, physiotherapy, definitely, it's a treatment. Compliance, speaking about treatment, that word. Walking program is under treatment. Walking 30 minutes under treatment. Recovering well is, you speak about treatment, right? Progress. Improved range of motion, that's also recovering or improving. Treatment and progress. And current status, wants to return to work. Prolonged sitting, already still it is there, right? Even if he goes to the work, he has to sit long time. and heavy lifting remains the same. See, current status, there is no change in the workplace. And recovering well, pain after sitting, he has pain now, so that will modify the work condition. Moving stiffy still, employer supportive, avoid heavy lifting, regular breaks. Okay, including sample letters, don't take any template. Any letter, whoever writes, whoever the most respectful expert in the world, don't take that letter. There are different ways of presenting letter depending on your competency. So here you can have an introduction, one body paragraph and conclusion, no issue. But now I try to make it 3 paragraphs because there are 3 compartments clearly. Is one paragraph speaks about history, next paragraph speaks about treatment and progress. The very next paragraph tells what is the status now. Depending on that, you have to have the request. Workplace assessment and, sorry, that is repeated, okay? Yeah. So somebody was asking which is being assessed. This is the part which is being assessed, okay? Already I told you purpose, why are you writing this letter? Body paragraph 1, history, what happened to the patient? You see the beauty. Why are you writing the letter? Then you have to say what happened to the patient, right? Then what has been done? What did you do? No? Yes. You take a simple case, any case coming to the hospital. Why they have come and what happened to them? Have they done some first aid, or did they go to another hospital where they admitted earlier, or did they have some previous treatment history? How has the patient responded? Then body of paragraph 3, what problems remain? What is the current status? And how do they affect the functioning? Then request. What do I need you to do next? What the occupational therapist must do next? Visualize that. Okay? Yes. Same thing. Last column is introduce the referral, clinical background, treatment and progress, present condition and limitations, and request action by the occupational therapist. Try to bring in these columns for every case note that you take. Okay? This visualization will clearly give you a clarity and competency in your brain. Okay? We have already written this. You have to write purpose. What are you writing? Why are you writing this letter? What happened to the patient? What has been done and how will the patient? You have to write answers for these things, which I have done yesterday. We are just connecting. Now, evaluation is done based on 10 skills. Now, if you submit one letter to me, I have to evaluate based on 10 skills. And I have done a detailed session about assessment criteria. It is uploaded. Every bit of it, what is being assessed in your letter. So when I evaluate or anybody evaluates, your letters will be categorized into different groups. One is beginner. Okay. Then other one is developing. The other one is competent. The other one proficient. Competent means almost like 350 to 400. 400 to 500, proficient. Okay. Different criteria will be used for that. What are the criteria? Evaluation criteria. Identify the purpose of the letter. Are you able to? The question has to be asked. Are you able to identify the purpose of the referral? Why it is referred? It's not because he has lower back pain. Okay, that's the problem. Purpose is because I am stressing it because many of you have written that as the purpose. Having back injury or back pain. Second, select relevant case notes. Are you able to select the relevant case notes? Have you included irrelevant case notes? Do you know how to organize information logically? Paragraph structure. Do you know how to write an effective purpose paragraph, including all those 4 segments? Do you know to use appropriate paragraph structure, the topic sentence, a controlling idea, then supporting sentence explaining topic sentence, then developing sentence, some data given, then conclusion. Then 6, do you know to apply formal medical language? Somebody was asking that. We'll be giving you explanation on that. 7th one, do you demonstrate grammatical accuracy? Are there grammar mistakes? Do you use cohesive devices effectively? As I said, introductory paragraphs, sequential expressions, okay, introductory phrases, conjunctions, commas, all these are cohesive devices. And we'll be dealing with it in detail. Do you meet the word requirement? Do you produce a reader-centered referral, focusing everything to the reader? Here, the occupational therapist. What is required for him to make the workplace assessment? That's all need to be included. So you can ask these questions to yourself and tell me, where do you have challenge? Which area? Or do you have challenges in all the areas? So I can customize the lessons depending on that. Do you have any doubt regarding these aspects? Only if you know, you will be able to tell me, okay, I have challenge in this area. Okay. Transforming case notes into professional sentences. Into a simple sentence, converting the case note. You know what is a simple sentence, right? Subject,
Yes.
verb, object, SVO. Okay. Simple sentence, Sneha likes sweets. Subject is Sneha, likes, verb, object, sweets. Even if you say Sneha sleeps, that's a simple sentence. Need not be object also, okay? But simple sentence doesn't mean short sentence. It can be very long. But one subject, one verb. There can be so many adjectives. Okay, SVO order. I'm not going into details of it. This is Malayalam and Kannada and Tamil. Now, wants return to work. This is the case note. Can you write a sentence? Simple sentence?
Yes.
She wants
Yeah.
John.
Status.
John wants to return
Yes.
to work.
Yeah. Somebody can type in if you are good at typing. I have challenges in all the areas. Okay. Ms. Everest, don't worry. Okay, we will take note of those things. Those who have challenges in all the areas, we will take you from scratch, okay? From very beginning. Like we will teach you to write. Now I am just showing you what is to be done, but I will teach you to write maybe different case notes, different types of sentences, and how to create sentences. Yes. Multi-visit challenge to summarize or it. Multi-visit challenge to summarize. Okay. Okay. Mr. Jones wishes to return to work. Okay. Good. Jones wants to return to work. Okay. John wishes, wants, no problem. Both are right. Jones desires to go back to work. Better return to work. Okay. Go back is okay. It's a bit colloquial, not very professional. You can use the same word. John desires. You see, John desires, John wants, John wishes to go back to work. Yeah. Urge to come back to workplace. No. Urge to come back to workplace. No, not exactly. Wants to. Wants is not urge. Urge is very instinctive word. Okay, don't use those words. Okay. Okay. Cool. And those who are like having challenge, beginners and all, you have to connect to me. Okay. It all depends because I am having my active schedules. So you have to keep messaging me and reminding me. Only when you cry, they say, only the child which cries will get the milk, it seems. So keep crying. That's all. Second one, severe lower back pain, back strain. You can roughly write, then I'll show you the sentences. Forklift driver. Prolonged sitting. Heavy lifting. Hurt lifting heavy box. Wants to resume to work, no? Wants to resume the work. Resume the work, not resume to work. Wishes to return to workplace. Wishes to return to workplace. Okay, Jones complains of severe lower back pain. He has severe lower back pain. Jones was diagnosed with severe lower back pain. He is forklift driver. Jones is a forklift driver. Yes, good. He is suffering from severe back pain. Yeah, different options. That's what I said. You can have different options in constructing your sentences, different words depending on your vocabulary.
Want to rejoin?
Sorry?
Want to rejoin further?
Want to rejoin is not exactly the concept. Return to the work. Rejoin doesn't mean returning to the same work. Maybe once you are fired from the job, then you are invited, you can rejoin.
Return to work.
Return is okay. Resume is also okay. Yes. Mr. Jones experienced severe lower back pain. That's great. He has been diagnosed with severe lower back pain. Oh, that's great. Moja. So, yeah, that's a good expression. Mr. Jones' duties involve prolonged sitting. Okay. He has lower back strain. Okay. He works as a forklift driver. Yes. Mr. Jones works as a forklift operator. That's also good. Operator. Mr. Jones' duties requires no. Mr. Jones' duties requires no. Require. Subject verb agreement. Mr. Jones' duties plural. So require, no requires. Heavy lifting. Those will be penalized. He is eager to return to his work, but complaint is severe lower backache. Yeah. Okay. He has severe back pain.
Father,
Yeah.
sorry to interrupt. Father.
Please. Yeah.
Come again, Father. About these plural words, duties and duty. Plural.
Duties,
requires.
duties plural, no? Jones' duty. Mr. Jones' duty requires is okay. If you write duties, you can't put requires. You have to put require. No S with the require. Like
okay.
Only in the third person singular present tense, you add S.
Okay.
She plays, but we play. They play. She
Got it,
works.
Father.
He works.
Since they are mentioned as it is forklift driver, and sometimes he has to he has to sit for a long time, and he has also do this heavy lifting. So both together is plural. So we need to add, we need to pronounce as duties require.
Duties required. But actually duties is not required here. Duty. His job or his work or duty. Plural is not required here. Duty requires. Duties. Duty requires.
Duty requires. Okay.
Yeah. Shall I go into the sentences? Some of the example sentences are these. Okay. Mr. Jones wishes to return to work. Is cool. Okay. Severe lower back pain. Mr. Jones was diagnosed with a severe lower back strain. Okay. He feels is not exactly professional language. Maybe you can say better will be experiences here, but that professionally he was diagnosed, right? It comes a diagnosis. So this is the best expression. It doesn't mean your expressions or your sentences are wrong, okay? There are different ways of expressing. That's why I said, if I say Mr. Jones was feeling a severe lower back pain, it's not feeling, he was diagnosed. Maybe patients will feel different things. That need not be the diagnosis, right? I may
Yes.
feel breathlessness.
It's not a diagnosis.
Yeah,
Symptom.
that is not diagnosis. Diagnosis, maybe I have a block in the wall. Okay. So,
It's confirmation.
yeah, somebody asked me that doubt. Is it professional? Now this is professional. Forklift driver. Mr. Jones works as a forklift driver. Or Mr. Jones is a forklift driver. Or prolonged sitting. His job requires prolonged sitting. You don't require his jobs. If you put jobs, you cannot write requires. It must be require.
Yes.
So his job requires prolonged sitting. Heavy lifting. His job also involves heavy lifting. See, instead of repeating requires, I have put his job also involves heavy lifting. Same syntax, but different words used. The more different the words are, better your letter.
Can we
Hurting.
write
Sorry. Hurt lifting heavy box.
can
Mr.
we
Jones
write
injured.
job
Please mute if you are not talking to me. Mr. Jones injured his back while lifting a heavy box at work. Mr. Jones injured his back while lifting a heavy box at work. I have created a sentence. Yeah. It can be another option could be Mr. Jones sustained a lower back injury while lifting a heavy box at work. Okay.
Father, sorry to irritate you, Father.
Yeah, please.
This prolonged sitting and heavy lifting, these both case notes, if I want to convert these simple sentences into complex sentence or compound sentence,
yeah.
Can I pronounce as his duties? His duties.
Don't go into complex now. Now we'll go to compound, then we'll go to complex.
Okay, Father.
Okay. Yeah. Otherwise, people, those who are not competent will find it. Please. Somebody wanted to.
Father,
Yeah, please.
can we write like that? His job consists of prolonged sitting. Write like that.
His job consists. No, consists means certain things. A bag consists of apples and strawberries and apple. Some other thing. This is involves or requires, not consists. Consists is a very colloquial expression.
Okay.
But consist is okay. If you want just 300, it's cool, ma. Even if you use that word, you'll get 300, no problem. Till
Can we write
340
demand,
easily.
Father?
Pardon?
Can we write his job demands?
Yeah, his job demands, you can write. Demands, you can write, yeah. Such words you can use, no problem. Is that cool?
Yes.
Do you want more work on this? What do you suggest?
Yes, Father.
Father, that
Yes.
wording and means that where we are facing problem there only. That which words exactly we use there.
Yeah, that is vocabulary, building up vocabulary. That's why I said you should have a diary of vocabulary, synonyms for expressions. That is not only for reading and listening, for all the 4 subtests. Write those expressions, what is being used. Write down, okay? And this is not only for writing. When you use listening, there are so many words used. You build up the vocabulary, definitely you will understand. Otherwise, suddenly you can't get a word, right? Unless it is in your brain. So it's a gradual process. As you go on with the training, you will automatically get it. You don't require so many words here. I'll tell you at the end, I will summarize the whole writing. What exactly is required? You don't require so many things. Okay? Maybe I'll give you exactly diagnosis and connected all the words I'll give you. What all words could and can be used. Okay? Now involves, requires, demands. So I'll give you some 6 words which can be used professionally in such situations. Same situations will happen in almost all the case notes. Okay?
Yes,
physiotherapy. Case note says only physiotherapy. Can you write a sentence? Are you all tired? I don't know. Don't see smiles on your
No,
face?
Father.
No, Father.
Yeah, if it is too long, take some snacks or some tea, coffee. I can give you 2 minutes break. Others can discuss by the meantime. If you have somebody having tea or coffee at hand, always have something with you, okay? So
Yes,
that you can
Father.
enjoy. When I don't see your smiles, I will stop session. That's the problem. The more the smiles, longer the session. If you want me to cut short, don't smile.
Excuse me,
Those who are
Father, I will
smiling,
take 3 minutes.
pardon?
I will take 3 minutes just
Please, please,
to
please, yeah,
come back.
please.
Thank
Take,
you.
so that you'll be fresh. You can take, wash your face and relax. I'll not be taking anything until I say we are starting, okay? Yeah. Others, those who already have something, try to enjoy it. Some snacks. I luckily got some snacks. I can give you, Ganesh.
Okay. Hello, Father. Father, please, I have a question.
Please.
Okay. Yes, Father, please, this recording, can it be sent to, can I have it after the class, please?
These recordings are always there in our channel, ma. It's
Okay, they'll be put in the channel.
Yeah, this is live, right? So it is automatically recorded. It is there in the channel.
Okay.
You can revisit. And yesterday's recording, I have sent the link even with today's recordings.
All right. Thank you, Father.
Yeah, yeah. And playlists are being, every day it is posted in the main Telegram group. Playlist means about reading. There are nearly 350 plus session recordings. You can find with one link.
All right.
Yeah. When you click on that one link, you will get all the recordings.
Okay. All right, Father, please, when do you usually have classes?
It all depends on the interest of the participants, need of the participants.
Okay.
Not when I dream or when I want to. When do you feed your children?
Pardon?
When do you feed your children? Mostly when they ask for it, right? Or when they cry.
The problem is I wouldn't know when to join.
Yeah, normally it is 8:30 we have discussions. 4:30 is Indian time, class time.
Yes, but
Normally,
I don't know when
normally,
is that?
Yeah, maybe Shanmuga will tell you. 4:30 is Indian 4:30, UK time.
Okay, please, do we have a WhatsApp group?
Yeah, we have
Indian
WhatsApp
time
community.
8:30 means UK time 4 o'clock, Father.
Yeah, Nitya, could you just write it down? We'll
I would
try
love to join
all
the
timings,
WhatsApp group so that I can
because
get
timing has
updates.
changed. Recently
in winter
changed.
and summer.
Yeah, that will be changing. As of now, it is
4:30.
4:30. Okay. And anyone else from Sudan? Give me your timing. 4:30, 8:30 time. Sudan, Nigeria, any other country? Please give me your timing so that we can post it in the main platform. Because people keep on asking me. Even somebody was repeatedly calling me. Then I took maybe thinking there is some issue. Then the person from other country was asking me, I want to know what is this UK time. Okay. So I can't answer that, right? I have a daughter in the UK. You can Google and find out. Anyone else from other country? Give me your timing. 8:30 means Indian timing. What is your timing? Want to consider or was but busy? Okay, Chandravadini. No problem, Chandravadini. You can attend. You see the recordings. Sorry, you can type in the YouTube comment space if you are from any other country. What is the equivalent time of 8:30 Indian time? UK 4:30. California time is not mentioned. Is it 4 p.m.? California, UK 4:30, 4 p.m. Saudi 6 p.m. Nitya, Saudi 6 p.m. California 10 a.m. Saudi 6 p.m. This is the equivalent of 8:30, right? 8:30 p.m. India time. California 10 a.m. Sudan 10:30.
10:30 AM or PM, Father?
AM or PM? Sudan? Tajoj, could you tell us AM or PM?
I think it is PM, Father.
PM. And
Yeah.
Oman is 9:30 p.m. KSA 7:50 p.m.
15 or 50, Father? 150.
50.
50. Okay.
And Oman, there are two opinions. One says 9:30, one says 7 p.m. I don't know.
I think 7 PM, Father.
Okay, Oman 7 p.m. then. Then Kuwait is 6 p.m. And whenever we post notice, below it just put in reply mode and say it is Sudan this time. If you know the timing, no, just post it so that it benefits others.
Father, please, how do I have the link to WhatsApp community?
WhatsApp community link.
Yes.
We will post it. Let's see. Anita Taj is not here, right? One sec. Oh, I am sharing otherwise. Okay. Remind me at the end, okay? I'll give you.
All right. Thank you, Father.
Yeah. Now, many are again questioning, asking me why I am not getting link, why I am not getting link. I used to send, or whenever there is session, I used to send at least 2,000 to 3,000 people the links, okay? But now WhatsApp is charging for the messages. One message will be charged 85 paise, that's why I'm not sending. Okay, 1,000 messages, like 3,000 messages will cost me nearly 2,500 rupees. So WhatsApp is not so generous like EduSkills.
I used to receive message for the classes before, and I
Yeah.
stopped receiving. So I thought the class is not
No,
taking place any longer.
No, because WhatsApp has taken away free message broadcast facilities. Now we have to pay 1,000 messages, 850 rupees. Yes, Libya 5:30.
PM or AM, Father?
PM. Okay. Yeah, Lini Varghese is saying go to clock and write country name, automatically it will show. Yeah, that advice can be taken by others. And just type in, okay, whenever we have sessions, when you read the notice, you can just type in Sudan time, UK time. Don't worry, so that after some time, everybody will be familiar. Okay. Further, I have difficulty in writing sentence. We will help you, don't worry. Okay. We'll help you exactly basic. And we'll have general English sessions for you, those who need very basic, like sentence construction and all those things. Yeah. Keep connecting and tell me also in WhatsApp, okay? This message. Yeah. Sudan, 2 hours post Oman time. Yeah. Nigeria, 4 p.m. Nigeria, 4 p.m. World clock. Lini Varghese is saying about world clock. We'll have to explain a little more. So take it as a mission. Post your timings when we post a link or session, when you post about. Whenever you see it, it takes 1 or 2 seconds just to type in your timing, okay? That will help all other people from that country, especially those who are beginners. Mr. Jones needs to join back his work. Okay. Ghana, 3 p.m. Ghana, 3 p.m. Yes. Mr. Jones needs to join back his work. I have a question regarding suitable tenses to use in different paragraphs. Yeah, we'll be giving you exactly for each case note, what type of case note, which type of sentence is to be used. Grammar tenses, okay? That's later part. First, we have to construct the sentence, then we'll have clarification on that. I will be teaching you. Yes, I love OET, yes. Are you ready? Why at YouTube it is not? Okay. Yes. Chat rate is just 8. So ready, you can just type in ready, okay? But then chat rate also will enhance. It's 17 now. Send some love at comment space. EduSkills is a free platform. Yeah, thank you, Ranjani. Yes, ready for the yes. 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 Ready, ready, ready. Type in ready. At YouTube comment space. God bless you. Thank you. Yes, ready, Father. Now maybe, yeah. Shall we begin? Dr. Salafa?
Yes, Father, I'm ready.
Yeah. Yeah. Now, one thing, there are two options. Either you can take it as homework and do it yourself, or you want me to help you.
If we did it as a homework, do we need to send it for correction?
Correction you can present, or like next time we will just share the right answers. Then you will correct it on screen, or we can send you the correct answers. Because corrections, individual corrections, because there will be like I'll have to write the whole. Sometimes I'll have to write all the sentences myself, correcting the basic beginners and all that. Now, if you have time, working out here will be beneficial for you.
Yes, yes, we have.
You have, but it will be going slow. You require patience. So you get a lot of ideas how others are using different words.
Okay.
Yes. One sec. Give me one sec. Hello. Okay. Physiotherapy. Can you make a sentence?
Yes.
In mobile, go to clock the down. You can find world clock, then select country to show the correct time for that country. Yeah, Lenny Verghese is giving a clue. In mobile, go to clock, and at the bottom you can find world clock, then select country. It will show the correct time of that country. Yes. Bharat is ready. Yeah, Mr. Jones was referred for physical therapy. Okay. Jones was managed with physiotherapy. Okay, next one. Compliance. Jones was managed with physiotherapy. Physiotherapy was arranged for Jones. Okay. Okay, next, walking program. Jones was managed. Yeah. Physiotherapy was arranged. He was recommended physiotherapy. See, different expressions. He was referred to physiotherapist. He was not referred, he was referred to. Not he was referred to, he was referred to. He has commenced on some physiotherapy sessions. Okay. Jones undergone physiotherapy.
He was initiated with physiotherapy sessions, Father.
He was initiated with physiotherapy sessions. Okay. 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 Was suggested with walking program. He was suggested with walking program, walking exercises. Mr. Jones has attended the physiotherapy sessions regularly. Mr. Jones was compliant within the physiotherapy sessions, with the physiotherapy sessions. He was advised physiotherapy. Okay. Different expressions, you see. Everybody has written different sentences. So that's what I say. If you can post it in the groups, people get ideas. Different ideas. Okay, this is a better expression. That's how we learn. That's why we say empower each other and grow together. Yes. Walking 30 minutes. So Jones currently attending regular physiotherapy. Physiotherapy was commenced. Gradual.
Please, I want to confirm.
Pardon?
Mr. Jones was referred to a therapist. Is that correct?
He was referred to. It says he was referred to. It doesn't say he had gone, no? He was referred. Yeah, you can say he was referred, but the next sentence you will have to say he was regular.
Okay, so I can say he was referred
the other situation is that he was referred at the same time he was undergoing it, right? He was compliant with it.
Okay.
So it depends what you say next. Then if you say he was regular in his physiotherapy sessions or something of that sort, you'll have to mention later. Okay. Walking 30 minutes. He was referred to physiotherapy. It's not referred to physiotherapy. He was referred for physiotherapy or referred to physiotherapist. Okay.
Come again, Father.
There is in the comment space, he was referred to physiotherapy. No, he was referred for physiotherapy or he was referred to physiotherapist. You can't say he was referred to physiotherapy. He was referred to physiotherapist designation. Currently, he is able to maintain walking for 30 minutes. Okay. Jones could tolerate walking for 30 minutes. Okay. He was managed. No, he was managed to walk 30 minutes. No, he managed, not he was managed. He was managed, the opposite meaning. He managed is enough. No, he was managed. he managed to walk 30 minutes. Mr. Jones now is recovering well. Yes. This has to happen in your discussions during whenever you are free. You have to post these sentences in the platform. Everybody posting, it will be very rich. Even I can find a lot of varieties and what your mistakes are. Then I can customize. Maybe I can just copy those things and customize my sessions. That becomes more effective. Okay, recovering well, improved range of motion. He reached maximum 30 minutes in upgrading gradually his walk. Need to polish that sentence. That sentence has to be polished. He reached maximum 30 minutes in upgrading gradually his walk. That is run-on sentence or wordy sentence. You'll have to repolish it. His range of motion has improved. Yeah. He was compliant. Compliance regular therapeutic. He was compliant, compliant, L-I-A-N-T, compliant with regular therapeutic exercise. Okay, Mr. Jones is compliant with his physiotherapy program. We can also say physiotherapy regimen, exercise regimen. Oh. Mr. Jones' range of motion has increased. Mr. Jones has compliant, L-I-A-N-T, okay? Not complained, compliant, P-L-I-A-N-T, to exercise regimes. He has been in walking program.
Father, however, the patient shows significantly recovered.
No, however, you can't use because you have no connection with, you are contrasting with what? There should be something before it, right?
Okay,
to contrast. Yeah, you can't start a sentence with however. Okay. That happens only in a paragraph, not in a simple sentence.
Negative meaning?
No. Okay, if you want some models, here, physiotherapy. He was referred for physiotherapy. He attended physiotherapy regularly. Now, he was referred for physiotherapy. Doesn't completely say he attended or not. Okay. But then it depends on your sentence. Next sentence. He complied well with his treatment, or he was compliant. C-O-M-P-L-I-A-N-T. Complied well with his treatment. He was compliant with physiotherapy. See, now if you are saying he was referred to physiotherapy, he complied well with his treatment, that is okay. Because next sentence tells you he complied. He was referred, he complied. Then next you will combine them, those sentences. Walking program. He followed a daily walking program. He was advised to follow a daily walking program. Both options are okay. Walking 30 minutes. He walks for 30 minutes every day. He is able to walk for 30 minutes each day. See, different words are used, same meaning. Recovering well. He is recovering well. His recovery has been satisfactory. His recovery has been satisfactory. Only in medical profession, okay? If your contact certificate mentions satisfactory, what does it mean? You get a contact certificate from your college or from your hospital and it says your conduct is satisfactory. What does it mean?
Means it's good. Yeah.
It means it is good.
No. It says it's not good.
Satisfactory?
Yeah. If somebody writes in a certificate is her conduct is satisfactory, it means not good.
Oh,
not commendable. Not commendable. Satisfactory has that meaning, like not okay. They will not write bad. Nowhere they will write bad. Conduct is bad. Okay, they will write satisfactory. But here, his recovery has been satisfactory means, okay, this is good. Commendable in medical science, but in general thing, it's satisfactory as a negative meaning. Improved ROM, his range of motion has
Sorry,
improved.
Father. Sorry to
Please.
bring you back.
Yeah.
Did you say satisfactory in medical is not good?
Yeah, in medical it is good. In health professional language it is good. But in general language, professional, otherwise general professional language, it's not very good.
Okay.
Satisfactory means not very good. Okay, but here it is. His recovery has been satisfactory means it's commendable, good. He's recovering well. Recovering well. Yes.
Wow.
So, Father, sorry. So, are you
is it
saying
a
that
synonym?
recovery well? Oh, sorry to bother. Are you saying that recovery well? That a simple sentence is recovering has been satisfactory. Is that correct?
Correct. Because
All
you
right.
are a health professional, you are using medical language.
All right. Thank you.
That is fine. Yeah. It
Father,
means
my question
satisfactory
was
means well. Sorry.
regarding the general meaning of satisfactory. Is it acceptable? It is the synonym of acceptable. When we say something acceptable, it means it's not good, but it's okay.
Not acceptable. It's not synonym of acceptable. If I'm writing in your conduct certificate, Dr. Salafa's conduct is satisfactory, means the meaning, exact meaning is that I don't commend her. I don't recommend her conduct. I am not happy with her conduct, her character. Yeah.
Okay.
Yeah. Not the other one. Yeah. Then he has an improved range of motion. Yeah. Two ways of saying it. How beautiful.
Yes.
Pain after sitting. Beginners, you have to practice only this way, no other way, okay? And if you find difficulty in doing anything with the letter, this is the thing that you have to do. Then automatically your competency will improve. You have to convert all the sentences into simple sentences. Then we'll show you how to combine them and put into compound sentences.
He experienced pain after sitting.
Okay. He is recovering well. He has made good progress. Okay. Mr. Jones experiences pain after sitting. It may not be exactly after sitting. While sitting also he experiences pain, right? So you can say Mr. Jones experiences pain sitting. Not after, right?
Prolonged sitting is also there now, Father, in current
Prolonged
status.
sitting. Yeah, prolonged sitting, yeah. You can write prolonged sitting. His range of motion has improved, yeah. He experienced pain following sitting position. Following a sitting position. Instead of following a sitting position, you can say prolonged sitting. Okay. Next one. Sorry. Next one, moving stiffly. Moving stiffly. His pain intensifies while sitting. Not only while sitting, there's a prolonged sitting, right? Short sitting is okay for him. Longer sitting. He reported pain with prolonged sitting. That's great. He has made good recovery. However, he experiences pain while sitting. Okay, that is complex sentence. Yeah, let's see.
Father, here what problem remains now after the treatment? Despite of all the treatment, despite of all the interventions, still the patient persists continuously moving stiffly. Can mention like that?
No, yeah. He's still moving stiffly. He is still moving stiffly. You can mention, but you are going little ahead, Amma. Ganesh, you are a little faster than us. Okay.
It's not fast, father.
Next
It's
step.
not fast.
You are in the next step.
It's all your videos you have watched now, so just.
Yeah, that's cool. That's cool. Yeah, that's good. Please don't scribble on the screen. There is somebody scribbling on my screen. Then I have
Can
to
we
go.
write like that? Despite of intervention, he is moving stiffly.
Sorry, one sec. I am just cleaning my screen. I am coming back. Yes. What did you ask? Yeah, one more time.
Despite of interventions, he is moving stiffly. Despite
Yeah,
of
but
intervention,
now
he
we
is
are
moving stiffly.
asking. We are just asking for a simple sentence, ma. You are also going with Ganesh little faster. Patience, slow down.
His movement is stiffy.
Yeah, that's good. You have that consciousness. Which paragraph is this that you have in your mind? That's why you are able to say that. That we are talking to fresh minds. See, that's a good sign. That's why I gave you that paragraph structure. No, you have to put in those columns. Then you know. Now, what Ganesh said, he knows that is in the third body paragraph. That's why he said, in spite of all the interventions, still is moving stiffly.
Stiffly.
Yeah. That only when you know which paragraph. So that's what I said. As you go on, automatically you feel, okay, this is in this paragraph and it has to be done like this. Because all the previous paragraph, whatever you said is in your brain. That's a good sign. Employer supportive. He reported movement stiffness. Okay, good.
His employer is supportive.
Yeah, his employer is
His
supportive.
employer is supportive.
Yeah, yeah. His employer is supportive of his returning to the work. His moves are stiff. Okay. Mr. John is supported by his employer. Okay. His movement still noticed to be stiffly. Yes. He experienced difficulty in movement. Okay. That's cool. Yeah, that's great. Avoid heavy lifting. You know, when you are saying avoid heavy lifting, where does it appear? In which paragraph?
Treatment.
Treatment last. Advice.
Advice. At the end, advice is given. You can go to work, but don't sit too long. Take breaks. Then also avoid.
He has been advised to avoid heavy lifting, father.
Yeah. Heavy lifting and take breaks in between.
Regular break.
Yeah.
Regular breaks.
Regular breaks. Yeah. That is at the end. Yeah. Regular breaks. He was advised to avoid heavy lifting. What is the advice spelling?
ADVISED.
It is SED, not advice, CED.
Yeah. If it is noun with C, if it is verb with S.
Yeah. And advice is also like voucher, what you get, bills and vouchers. They are known as advice, the noun. Yeah. You cannot be advised CED. You have to be advised SED. Yes.
Can
For
we
beginners,
say advice
we
regarding
will be. Sorry.
Can we say advice regarding heavy lifting was provided?
One more time.
I said regarding advice heavy lifting. Can we say advice regarding heavy lifting was provided?
No, not was provided. He was advised regarding avoiding heavy lifting. He was advised, or otherwise you can say he was advised on avoiding heavy lifting. Yeah. Despite having all interventions, he suffers pain and stiffness. Yeah, Lidinberg is going little fast, no problem. You are an advanced learner. You are right. Yes, please.
Advice, after advice, we have the verb will be infinitive form. It is better if you would like to make a listing for advice, it is better to say advice to take and rest and um, to
Avoid.
manage or manage. I mean, it is better to add to and verb or just verb.
Advice to.
Yeah, I understand. But and when I would like to make a listing, the second one,
Listing,
it is
advice to. He was advised, and if you are going on to listing, you need not add to.
no need.
No. At the end, you have to add to after the list, when the list ends.
Okay, thank you.
Yeah, about advice, CS, all those things we have for beginners segments, we have all the explanations. Also, we'll be coming back to it when we go with the beginners. And we'll be starting a fresh beginners batch with a new channel, everything exactly, task, and 15 minutes in a day and 45 minutes in a week. One live session and 6 tasks. You'll have exactly step by step. Those who have time, you can message me. So that will be entirely different channel. There will not be any confusion. So you can go step by step. Yes. Beginners, I mean, beginners. Yes, advice now. Yeah, advice C is noun. You can remember this way. C comes first, right? In the alphabet, C comes first. So N comes N. Verb comes, V comes later. So V is always with S, later one. C is always with the first one, noun. N and V, noun and verb. Yes. Middle of his work, he is recommended to regular breaks. In middle of his work, he is recommended. No. He is recommended to regular breaks means you do not write. In the middle of his work is understood. Regular breaks means in the middle of his work, so you don't write that. Mr. Jones has advised to avoid lifting heavy. No. Jones has advised means he has advised the physiotherapist. He was advised. John was advised. Okay, not John has advised. John has advised means he is advising someone else. John was advised. Advice, advises, advised. Okay.
Yes.
And he was advised to avoid heavy lifting and to take regular breaks. He was advised to avoid heavy lifting and regular breaks. And to is not required, and regular. Take is also not required, and regular breaks. He was advised regular breaks. He was advised regular breaks. You do not say he was advised to regular breaks. He was advised regular breaks. Okay. Workplace assessment. He has been encouraged to take regular breaks. Cool. That is good. Regular breaks was recommended. Okay. Workplace assessment. You can collect several of these sentences and put into Grammarly. Okay, paste into Grammarly. You will enjoy. And there will be revelation, real revelation. What are the difficulties? Because in the Grammarly, you know, on the right side, when you click the word where they say underline, red underline, explanation will be given on the right side. Exactly, they'll explain and tell you what is the mistake. I am writing to request a workplace assessment for Mr. Jones. Okay. Yeah, that is at the beginning. He was advised to avoid heavy lifting and take regular breaks. Yes. He requires a workplace assessment. That is in the beginning. The workplace assessment is required. Okay, that is good. Suitable duties.
Assess and allot suitable duties to Mr. Jones.
Okay. Okay. Now, you know, the gymnastics of this is this. Now, those who are not aware of where this particular case note belongs to which paragraph, when you get into compound sentence and complex sentence, you will really enjoy. And you will see the difference when it appears in first paragraph, second paragraph, third paragraph, how the language differs. Okay, the flow of the language.
Was recommend suitable duties.
Yeah, it would be appreciated if you could provide recommendations regarding suitable duties that he could perform. He requires you. Okay, that's good. Your assessment would-
தெரியாதா அடிக்கடி இங்க கரண்ட் டக்கு டக்குன்னு இந்த இது அடிக்குது.
Please mute. Otherwise, we will be listening to your shouting. Yes. Let's check.
He was recommend suitable duties.
Pain after sitting. This was the one, right? Am I right? Pain
Yes,
after
Father.
sitting. He experiences pain after prolonged sitting. After prolonged sitting, not after sitting or not while sitting, after prolonged sitting. He develops pain after sitting for 20 to 30 minutes. More accurate. Okay.
Yes.
Moving stiffly. He is still moving stiffly. He is still. That is conscious of the paragraph. Okay. Last third body paragraph. He is still moving stiffly.
Situation.
Yeah. Employer supportive. His employer is supportive of his return to work. Otherwise, his employer is supportive. That's also a good sentence. But this is in the context. Avoid heavy lifting. He should avoid heavy lifting. Heavy lifting should be avoided. Regular breaks. He should take regular breaks. Regular breaks are recommended. Second one is more professional. Both are right. Workplace assessment. A workplace assessment is required. He requires a workplace assessment. Passive voice and active voice.
For the prolonged sitting, is it hyphenated? Do we need to add hyphen between prolonged and sitting?
No.
Okay.
No need. It's there are two words, adjective and verb. Yeah, we don't require. Only hyphen is given only when it is considered one word.
Okay.
Suitable duties. Suitable duties should be recommended. He requires advice regarding suitable duties. Beautiful, right?
Yes.
Do you have stamina to go on? Otherwise, we will continue in another session.
Yes, we have.
Maybe I will show you a couple of examples, not all. It will take a long time. Compound sentence, you know. Independent clause plus independent clause means two sentences. Simple sentence plus another simple sentence. Simple sentence plus simple sentence. Simple sentence plus comma plus conjunction plus simple sentence. Now, do you require a comma there? That's the question. Two independent clauses means two simple sentences joined with a comma and a conjunction. I'll explain about comma when I show you the sentence. It's clear, no? Two sentences connected with a conjunction and a comma.
Yes.
Simple sentence, Mr. Jones wishes to return to work. Another simple sentence, his employer is supportive of his return to work. Compound sentence, simple sentence, plus comma, plus conjunction, plus another simple sentence. Sorry. Can you make this sentence?
Just to return to work.
And
I'll put the previous
Yes.
screen, yeah. Can you write this sentence into compound sentence?
Yes.
yes.
Mr. John wishes to return to work, comma, and his employer is supportive of his return to work. Yes, supportive of his plan.
That
Something
will be
has
more
changed.
functional because you did not repeat. Probably, no? Mr. John wishes to return to work and his employer is supportive of this plan. Or something else, like the same words need not be repeated probably. That's advanced, little advanced. Now, Mr. Jones was diagnosed with a severe lower back strain. Please don't scribble on the screen. Someone is scribbling on my screen. Please don't do that. They are not familiar how to use the screen. Don't touch the screen. There is one instrument, background distraction. Please mute when they are not interacting. Okay, Miss Jones was diagnosed with a severe lower back strain. One sentence. He was referred for physiotherapy. Another simple sentence. Simple sentence, comma, conjunction, simple sentence. Can you make it?
Yes, Mr. Jones was diagnosed with a severe lower back strain, comma,
So,
and he was referred. Or we can say Mr. Jones was diagnosed with a severe lower back strain and was referred for physiotherapy
Yeah.
without
Second one is right. First one is wrong. You should not repeat the
subject.
name or pronoun. You are right in the second go. You are right.
Okay.
Okay. And he was referred. Need not be put here.
You should omit
And was
comma.
referred to. But you can
Physiotherapy.
say he was, but that's not exactly not wrong, but it can be more professional, like, no? Mr. Jones was diagnosed with a severe strain and he was referred for physiotherapy and was referred to physiotherapy school and he was referred to is not required. You can put this. I can type it here. That's why I'm not changing. And this, yeah, one more we'll take, then I'll tell you. Yeah. Mr. Jones works as a forklift driver. His job requires prolonged sitting. Two sentences.
Yes.
Mr. John worked as a forklift driver, comma, and his job required prolonged sitting.
Yes.
Duties and
Because
the
we
beauty of the
have
English language.
two different subjects, right?
Mr. Jones works as a forklift driver and his duties or his duty, you can say, but then involves. If you say it's duty, it is involves. S must be added. This involves prolonged sitting. Now, why this comma?
Because
we have two different subjects here.
Yes.
Do you require this comma before and?
Yes, Father.
Yes.
Not essentially. This comma is known as Oxford comma. OXFORD, Oxford comma. This is introduced into English language only by Oxford University. Cambridge University and followers of Cambridge University don't use this. So in English, you can either use or you need not use. If you are using, do it continuously. If you are not using, don't do it. That's why it is known as Oxford comma. Oxford comma means one particular university recommends it.
Yeah.
If you are writing an essay to be assessed by Oxford University, definitely you have to. Definitely you must use it. Otherwise they will be angry. But then now you are into Cambridge University assessments. So even if you use Cambridge is tolerant, no issue. It is not wrong. Okay. But the better to know. Yeah.
Is it Oxford or splice comma?
Oxford comma. This after driver, forklift driver, there is a comma, right?
Yeah.
Even if you remove that comma, if there is no comma, that is sentence is right, compound sentence is right.
This
Even if
was
you
what
put
I'm
that,
going to ask. Yeah,
sorry,
further. Because yeah, this is what I was going to ask about. Because as we have understood, if we have two different subjects and we are joining them with a coordinating conjunction, we should write the comma. The comma here is mandatory. But for
no,
example, if it was single subject, we can omit the comma.
no, there is no rule like that. The rule is, in any case, when you have two simple sentences connected with a conjunction, you can either use comma or you will go without comma. There is no issue, no other rule in
Regardless
English.
of the subject.
Yeah, don't worry about other subject or object, nothing. If there is a conjunction and two sentences are combined, connected together, the comma can be used. That is Oxford comma, recommended by Oxford University. Even if you don't use comma there, you will not be penalized. But in one sentence you use, next sentence you don't use, you will be penalized. You have to stick on to one line of writing.
Is this the comma splice if we use in one sentence and omit it in the other? Or what is meant by this term? Comma splice.
Sorry?
Comma splice. S-P-L-I-C-E. What is it? Because we have heard about this in OET. They said if you omit comma in such a sentence, this will be regarded as a punctuation error, and it is called
punctuation error. No, that's why I said this is not. This doesn't come under punctuation error. But after the introductory phrase, for example, in the morning, the patient was very sick. After in the morning, there should be comma. Otherwise, it is a mistake.
Okay.
And when we come to complex sentence, I'll tell you, if you put the dependent clause first, after the dependent clause, there should be comma. There must be comma. If otherwise, it is a punctuation error. That in the self criteria, I have around 40 criteria. One criteria is punctuation error, where I will show you where in 4 situations you require punctuations. Identify the 4 situations in your essay and find whether you have put a comma after the introductory phrase. You have not put a comma, you will be penalized. After a dependent clause in a complex sentence, you have not put a comma, you will be penalized. When you present a list, in between the list items, if you have not put a comma, you will be penalized. So that will come at the end. I'll be giving you 40 criteria, A to Z of correction of your letter, which you can do by yourself.
Father?
Yes, please.
Because my understanding for Oxford comma is in the listing. When you say X, comma, Z, and Y, you can put the comma before and or no. This is an Oxford. This is my information before. That is why I'm confusing here. Yes.
I'm just coming back to you. One second. I'll take a Word document. Okay, I'm here. Okay. Let me get into a new page. Yes.
If you could mention the fourth one, Father, also, we'll be grateful. If you could mention the fourth side, you said after the opening sentence, after a dependent clause.
I'll come back. We'll be coming back to it. What was sorry, Salafa? Somebody else dictated something just now. What was that?
Yeah. Rufaida, can you repeat?
Yes. My understanding for Oxford comma in the listing, when you say like X, comma, X, Y, and Z.
X, comma, Y,
and Z.
Comma, and Z.
Yeah. For me, my understanding the Oxford comma, we can use the comma before and or not use it.
In listing.
Yeah, in the listing, yes.
One second. Yeah, and see. So this is what you are asking, right? Can you see my screen? No.
No, Father.
Sorry, one sec. Let me share. Okay. I'm trying to type what she said. X, Y, C. This is what you're asking, right?
Yeah.
Now, what I mean by Oxford comma. Now let us take here for better understanding grapes, comma, apple, comma,
Orange.
and
Banana.
Now, this comma,
This is Oxford comma.
this is known as Oxford comma. I'll write here. This is Oxford comma. All the books and works coming from Oxford will use this comma. Okay?
Yeah.
But if you write without this comma, you will not be penalized.
Yes, it's okay.
You are right in both the cases, whether you use it or don't use, you are right. But if you don't use, in the morning, I ate grapes, apple, and banana. In the morning. This is known as introductory phrase. There must be a comma. Sorry. Do you understand?
Yes.
Yes.
In the morning, I ate apple, grapes, apple, and banana. This is mandatory. Otherwise, that will be penalized. This comma is mandatory. Whereas before and, that is not mandatory.
Yes.
This is not mandatory. Then you will not be penalized for not writing this one. But this is mandatory.
Does it have a name, Father, the mandatory one, or no name?
Which one?
This one's a mandatory after in the morning.
Mandatory
Does
one
it
has
have
no
a-
name. No, that's punctuation. No special this. This is an exceptional. That's why you have a name, Oxford comma. Again, you see, though, although, Sneha was lazy,
Comma.
she scored high in her exam.
Complex sentence.
Yes.
Complex sentence, and here comma is mandatory.
Mandatory. Yes.
You will be
After-
penalized.
Yes.
You will be penalized if this comma is not used. That is
Yeah.
what we call punctuation.
Splice.
Okay. And I'll be
Yes.
teaching these things in detail when we come to that stage. Because when we go into complex sentence and when we come to punctuation, so there is no confusion in between.
Yeah.
I'll
But
be
the only
teaching.
confusion was between the two independent clauses. This was our confusion because we were thinking that it's mandatory if we are connecting two independent clauses with
Not
different
mandatory.
subjects,
Not
or
mandatory.
if we are repeating the subject. Yeah, this was our confusion.
No, not mandatory. In
Okay.
the when there is a conjunction, comma before conjunction is not mandatory. It's optional.
Yes.
But one discipline is there in our system, in English system. If you use it, you have to use continuously in the whole exam. If you are not using, don't use it in the whole exam.
Okay.
And one
Sorry.
place, in one sentence you use it, another sentence you don't use it. That is not accepted. Both will be considered as wrong. That's also same with the American spelling and British spellings.
Yes.
For example, program, PROGA.
Double ME in British.
Yes. So you have to use one. For example, color.
Yeah.
COLO, UR or
British.
LOR.
Yes.
So you have to use either this or that,
Yes.
not both. Okay. That is cool. Off the
Yes.
Yes.
Can I ask one question, please?
Yeah, definitely. You have the right to ask, ma'am. All are asking, yes.
Before
Smile and
such,
ask, but you have to smile and ask, otherwise I will not answer. Yes.
I'm smiling.
Okay.
Before such as and including, you need to put a comma.
Sorry, I didn't get you.
Before such as and including. Before, if I would like to make a listing, I would need comma before such as or include.
She means the connectors, before the connectors.
Yeah,
Or the
such
link.
as for
Huh?
linking.
Yeah, the conjunctions are the connectors, right? Conjunctions are the connectors, right?
The linking words, I think she mean.
If I would like to make a listing for including
She's
symptom,
asking about such as need a comma and then
comma
listing further.
No,
before
such as,
No need.
such as,
Yeah.
no need, no need.
Such
no
as
need.
mango, comma,
Yeah,
apple, grapes, like
yeah,
that.
yeah,
Yeah.
yeah, yeah.
No
No need,
need.
no need.
Yes.
Okay, okay. Yeah, good.
Okay, thank you.
Don't worry. And those things, don't worry, when we come to self-assessment criteria, that's our final stage, where the whole letter will be assessed by yourself and you will see to the grade at least A+, without my help. You will assess your own letter. And you will be able to assess the letters of others. We will give you letters of others, you will assess and give us. And write the comment. See, this is a punctuation problem, you have no marks. Okay, this is the what you call sequential expressions you have not used properly, no marks. And all things why you have marks. You have used both simple sentence, compound sentence, complex sentence, so you have marks on this criteria. And all those 10 skills will be assessed. And the 7 assessment criteria. That's the best part of it.
Hello, Father.
Yes, please.
Please, can we have an example of a sentence that has 2 independent clauses? And how can I identify it?
2 independent clause means 2 simple sentence.
Okay.
Yeah, simple sentence. I'll show you simple. One check. Let me share. Okay. Again, I'm sharing it. See, I said simple sentence plus simple sentence, comma,
I like you.
conjunction plus simple sentence. 2 simple sentences. For example, I love you. Okay. I don't want to marry you. Okay. Or take it, I love her, to make it more clear, but I don't want to marry her. Already I said the answer, right? How will you connect?
But with the contrasting.
Yeah, it's contrasting. So but will be the connector.
Yes.
So before but, do you require a comma? Not mandatory.
Not mandatory.
Or just take this. I opened the room. One simple sentence. She entered the room. How do you connect?
The 2 sentences are connected.
And she entered.
And
she
I
entered.
opened the room and she entered the room.
I opened the room and she
entered the room.
becomes this one, lowercase letter.
Yes.
Okay. Okay. Here, comma is not mandatory. I opened the room, comma is also fine. Even without comma is also fine.
Okay.
If I use then further, is it okay? Yeah. If instead of and, I used the sequential expression then. I opened the room, then she entered the room. Do I need comma? Yeah.
No, you can not. No need of comma. Okay, usually you cannot say that I opened the room, then that is actually a translation of vernacular. You need to say I opened the room and she entered the room. Then it's not required. And she entered the room. That is understood. Then she is understood. That's a translation of the vernacular. It needs to say I opened the room and she entered the room.
Okay.
Yeah.
Okay, Father. If
Yes.
ask you, please.
Yeah. You're welcome.
Thank you. If I omit the subject in second independent clause,
You can't omit here because both the actions are not by the same person.
No, in other example, if I have the same subject.
Same subject, you must omit the second one.
Okay, should I put comma before conjunction or not?
No need. Not mandatory. In any case, before conjunction is not mandatory. Because that's a Oxford comma, optional comma, Oxford comma, optional comma.
Yeah. Even
if you put a comma there, you will not be penalized. It is right. Even without comma, you are right. Both the cases, you are right.
Okay,
so if you are fond of comma because it looks like a ring, you can use it. If you hate comma, don't use it. In both the cases, you will not be penalized.
Okay, thank you so much.
Okay, you are welcome.
Father, kindly can you write this sentence? Mr. John sustained a back injury.
Mr.
Jones sustained a back injury.
Sustained a back injury.
Which was treated with physiotherapy. Which was treated with physiotherapy.
Was treated
with physiotherapy.
With physiotherapy, yes.
Yeah. The question is, do I need comma before which or no need?
No need.
No need?
Yeah, no need.
Okay.
Which was, when Sir John sustained a back injury, which was treated with physiotherapy. See, when you read itself, you can understand. If there is a comma, there is a half beat off. Do you say this way? Mr. John sustained a back injury, which was treated? No. You will say, Mr. John sustained a back injury, which was treated with physiotherapy.
Continuous.
Yeah.
Okay.
Yes.
Thank you, Father.
But then when you have conjunction, I opened the room, there's a half bit off, and she entered the room. So you can use or need not use.
Okay.
Yeah. That's the beauty of English language. The more you learn, more sweet it is. Yes. I think this is cool for you today. Too much heavy. I advise not to take too heavy work on OET. So I shouldn't trouble you. Yes.
So it's very useful.
Yes, very useful.
And also try to just send a feedback in the YouTube comment space. It helps a lot. When you say something, now you see Dr. Salafa said maybe she has a challenge in selecting the relevant case notes. So that's why I repeated it today and deleted and showed you and made those phrases, then converted into simple sentence. That selection of case notes I wanted to skip because we have done it yesterday. Yeah. Since you said that you need more clarity, we did it.
Thank you. Thank you so much.
So your feedback will help us a lot to customize. You can put in anything, any of your difficulties, challenges, and those 4 questions are applicable even for tomorrow, for this session as well. At least one learning. What did you learn? When you post it, others will understand, okay, this was the case. This I did not understand, but she understood. Yes. Now I get it. That's the real way of learning. That's why our tagline is empower each other, grow together. Yes. That's great.
Thank you, Father. It was very great session, actually.
Thank you. And if people are interested, we can take any sessions, no problem. We will find some time and we'll take. And initially, actually, at least one case note you have to do into at least 6 sessions to complete it. with self-assessment, minimum. If you are beginners, you need at least 10 sessions, including one case note, which means next case note onwards, you don't require such long time. With one session, you can complete because you know the criteria. You need to just go on saying.
Yes.
Yeah, to go step by step, all these 15 steps, at least 10 days or 10 sessions are required.
What time will be the next session?
You decide and tell me. It all depends on your. When the child cries, mommy will give the milk. It seems there is a saying in Malayalam. It seems. Okay. Okay. Even the timings and sessions are on request. All these 2 sessions are on a request from Dr. Salafa and team. That's why you have kept their convenient timings. Thank you.
Thank
Farah.
you very much.
Yes, and always try supporting us, okay? Because we have to maintain ourselves. It's a big platform. We don't charge anything. The tech team need to be sustained. Okay. Yeah. So what you can do is share with others, at least the link, and the more people benefit,
So this is
that's
the
the
least thing
satisfaction
we
there.
can do.
Sorry?
This is the least thing we can do to make a comment in the YouTube.
Yeah,
and
definitely.
share that.
Make a comment. It may not be big comment. You can just make one word. I love OET or I love EduSkills OET. Or one heart, one like. And if you have not liked, please like this session. If you have liked it, click that like button as well. When you say you liked it, algorithm, Google, the YouTube algorithm doesn't understand that language. Only when you click that heart or the thumbs up, that will, understand.
Yes.
Yeah, I understand your smiles. I can understand you like, you love.
Well, thank you so much, Father Celine, and God bless you.
Yeah, you are most welcome. You are most welcome.
On
I'm
behalf
happy
of
about,
my,
I am really
on
happy
behalf,
about Sulafa and team. You are encouraging, empowering
on behalf
attitude.
of my group, I would like to thank you from our hearts.
Yeah, you are
Actually,
most
there is no words that will be sufficient to thank you.
Yes.
Thank you so much, so much.
Yeah, you are
I
most
don't know
welcome.
what to say.
Yeah.
And
Only thing
because of you, we like OET and we like reading, listening, everything. This is because of you.
You
And
make it work.
a lot of our group members, they passed their exam successfully and they came and write their feedback in the group. They benefited too much from our discussions. And basically, we learned this discussion from your sessions. So I would like to thank you from my heart.
Yeah, you're most welcome. Thank you. Nice. Thank you for your nice words. And I don't follow your language there, no, so I don't know what are the comments. So you can update me if you need any sessions on anything. Since you are supporting our mission, definitely anytime you can ask for sessions. Maybe at least you'll have to tell me one day in advance so that I can organize my schedule.
Sure.
Because I don't follow that language, what you type there and all
I
that.
know it's very hard, yes.
Yeah, we need to continue with you, Father Celine. It's so informative sessions. Thank you so much.
Yes, definitely.
We
You're
will.
most welcome. And also, I wish that you share to maximum people, Sudan, Nigeria, South African countries, developing countries. Our motto is that because there are so many people who are struggling. Recently, I know one who passed from our platform. They have put a video on that. That guy has spent more than 10 lakhs on OET training. And he has a loan of 78 lakhs, including his studies, nursing studies, and all that. And without passing OET, he has no go. So on the 17th attempt, he came here after 16 attempts. Within 2 months, he passed with the high grades. And he has put a video. Such people, they can't go forward without cracking OET. Because 78 lakhs, they cannot manage anyway. Yeah. So try to share to maximum to those people, countries where there are poor people, health professionals who are financially struggling. And you get some 10 people, I'll be more happy to spend more time for them, even to take them from the scratch. Those are really financially struggling. Okay. Yeah.
And in the future, I would like to have sessions in basic English, Father. I remember you made a group, yeah, but I
Yeah.
think it's not yet
No,
active yet.
we are gradual planning it. We have started editing and all those things. We'll have basic. Yeah, basic means now what I said just now. No, simple sentence, subject, verb, object. Then the
Yes, yes.
conjunction,
Structure.
fanboys. Then
Yes, yes.
conjunctions are fanboys. All those 7 conjunctions. Then how they are connected. What does it mean, and all those things. Yeah, that will be
Yes.
taking. And the general English, you can just share a link to your group as well. As soon as we have some people, once in a week we'll have sessions on general English.
Okay.
Okay.
Yeah,
You can also suggest you can also suggest your timing. We can start this week itself.
Okay.
Yeah, upcoming week itself. You can start. You can just let us know what is a convenient day and timing. Once in a week will be enough because we'll be connecting that with this OET studies as well.
Yes, yes.
Okay. Yeah. Like this simple sentence, how to make simple sentence. What are the basic tenses or what are the articles?
Yeah. It is what we
Commas.
Yes.
Yes. Yeah.
Yes, exactly.
Yes. Yeah. Thank you. Thank you so much. God bless you all.
Thank you.
Keep going. Yes. Let's know what you require more. General English, we'll do it. Yeah. Okay. Let me check how many are there.
Yes,
And
Father, please, sorry. You
please.
make mention that you will share the WhatsApp community link so that I can join.
Okay, one sec. Let me check if I can access it from here.
Okay.
Just take my phone. Okay. WhatsApp community.
Or can I send you hi and then you forward it to me?
EduSkills. My phone is not responding properly. One sec. EduSkills. Yeah.
Okay, I'll send you a message for that.
Yeah.
Yes, I've just sent you a message.
Okay. You sent in WhatsApp, right?
Pardon?
If you are not in WhatsApp community, I can post it in the chat here as well. Message. You can join only one group community. Okay, there are 5 communities. I am posting both in YouTube and only those who are there, not there in any of the WhatsApp communities, we can join there. Because if at all a situation like Telegram is blocked something, at least we can sustain. So I have posted in YouTube comment space.
Yes, I have
the
joined.
WhatsApp community as well as, yeah. Join only one group. There are 5 community groups. One group is cool because we are posting the same thing, guiding the same way because there are limitation for the groups, WhatsApp groups. That's why we have several groups.
Thank
Yeah.
you.
Yes, you are most welcome. Yes, that is cool. Yeah, thank you so much. And general English, keep reminding me. All admins, you just post one more time that link and ask them to join. And send the suggestions regarding the day and time. We'll fix it permanently so that it won't break. Yeah, date and time is fixed permanently. I also know, so I can allot time for it. God bless you. So we are ending the stream, live stream.
Thank you.
Thank you, Father.
Thank you,
Thank
Father.
you, Father.
Bye. God bless you.
Bye, bye, bye.
Yes,
Bye.
please.
Father.
Yeah.
Thank you,
God bless.
Father.
Yes. Yeah.
Good night.
you.
You are most
Bye.
welcome. Yes.